And now that we are talking about all these post-operative issues, I wanted to also discuss with you what's about scarring. Okay, so scarring. I know that in our practice, patients look for our practice because of our results, and in particular because of our scarring or incision lines. So we are famous to have very nice incision lines. You can see these in many of the discussion groups in Facebook and so forth. But what's about the issue with the patients that don't scar very well? Well, let me tell you, we close everybody about the same. We use the same materials, very high quality materials, and we make really nice approximation. But the tissues don't heal always the same. And this is not necessarily your fault, but probably something that might be in your genetics that you have to consider, in your lifestyle, in your nutrition, and there's very many factors that are mainly patient related that will determine the type of scarring that you have. There are a few different abnormal scarring types, and sometimes we can see them, all of them, in one single scar. Sometimes you have a portion of the scar that is normal, a portion that is hyperpigmented, a portion that is hypertrophic, and another portion that is keloid. So all this type of abnormal scarring, sometimes you can see in the same, and we don't have yet a solution for it or a full understanding of this happen. Now, we can treat it and try to avoid this happening. If you develop abnormal scarring, we are very happy to guide you through the process and even perform a scar revision if needed. Occasionally, one thing that I want to tell you is when we do the surgeries at the beginning, sometimes, for example, in like brachioplasties or in tummy tucks, we close these areas under tension because we try to remove the maximum amount of skin. Now, when this happens, that scar might become hypertrophic, a little stretched out. Or if you have abnormal scarring like keloid, thicker. So if this happens and we catch it right away, we can do therapies injected with steroids and prevent this from happening. But if not, we can always come back, remove the scar and close it, in which case we're gonna close with least amount of tension so we can improve the chances of having normal scarring again.